It's the treatment that has the highest success rates in all IVF treatments.
You mentioned that another big group of patients that come to you, they are interested in PGT-A, genetic testing of embryos. Could you tell me a bit more about that? Who is that testing suitable for? When do you recommend it?
Normally, some clinics only do PGT-A testing to everyone. And we generally recommend PGT-A testing only if it's indicated. But of course, this is just a recommendation. If the patient is willing to do that test, they can be doing, they can choose to do so. But generally, the patients who are over the age of 38 and have many embryos on day 5, or if they have recurrent, repetitively having miscarriages, or having repetitive implantation failures, like IVF failures, then those would be benefiting from PGT testings because it would increase their live birth rates per embryo transfer. But the tricky part is whether we'll be able to find a genetically healthy embryo or not. So genetic testing would be just, as I said, it's a screening method, it's just testing, but it's not correcting any abnormality.
Okay. And how does that affect the patient's timeline? So you mentioned before it's related to then having a frozen transfer. So would that patient then have to come to Cyprus in multiple trips too?
Yes, so they will need to come for one cycle for the egg retrieval, and they can come, as I said, for only one day, and we can do the egg retrieval and they can return back. And not with the first cycle, because within that cycle we'll not be able to have the results. But with the second cycle, the earliest, they can start preparing for the embryo transfer. Or if they would like to postpone it for up until a bit later, like a couple of months later, or even maybe 1 year later, it's all okay. Because as long as they are frozen, they will be staying in the same position.
Yeah, so you mentioned it doesn't really correct any abnormalities, it's just a screening test.
Yes.
Is it worth it then, or for whom is it worth it?
As I mentioned, that's why the people who are willing to do this test should be counseled properly. So because it also has some limitations, and yes, they would be benefiting from it if they are over the age of 38. If there are repetitive IVF failures or miscarriages, they would benefit definitely from it. But the other, the population, whether they would be benefiting it or not is a question mark. So they shall not just pay more and maybe even decreasing their chance, because there's also a false result risk, and also sometimes the biopsies, the cells that are biopsied may not be representing the whole embryo. So that's why we shall inform them properly before they make that decision.
Is this something you discuss with patients during consultations?
Yes, we have to express them all of these advantages and disadvantages, limitations and strength, and then they shall evaluate it, and then they shall make their decision.
I'm curious about egg donation, if there's any reason why you would recommend it for a patient using donor eggs.
For the egg donation, it's the treatment that has the highest success rates in all IVF treatments. So yes, this provides a very viable option for women over a certain age, because if someone is in menopausal stage of their life, then they will not be able to provide any follicles, so IVF would be worthless. Apart from that, if a patient has tried multiple times and they're tired and they don't want to try again with their own eggs, then egg donation again is another option that they can choose to do. Or if a patient is having some kind of a specific genetic condition and they would like to just maximize their chance, sometimes they also choose to do the egg donation as well.
What is your experience working with patients over 50? What is the limit, age limit of patients that you tend to work with?
Normally, we don't have any age limits, but there are some rules that the Ministry of Health set. So we have to ask some additional tests or consultations because we don't want to put anyone at risk. So we have to have a kind of like an official documentation that that lady is fit for pregnancy, or we shall not be risking the mom because that person will become a mom, and during pregnancy she shall not have any potential complications, or she shall not have any risks that would be potentially risking the life of the fetus as well. So that's why the Ministry of Health requires us to ask for those documentation, such as like internal medicine specialist report or a cardiologist report. But after the age of 55, there are some additional consultations and some ethical committee opinions as well. But after the age of 55, this is something specific, like we have to discuss it with the patient as well.
Okay. So for patients above 50, there's an extra list of tests that you have to review?
After the age of 45, we have that list. And after the age of 55, they have to do some of them in North Cyprus even.
In North Cyprus, okay.
Yeah.
Yeah, and from your experience working with patients over 50, is there anything that needs to be done during the treatment to make sure that their chances are optimized?
Normally, those ladies are generally in their near menopause or near postmenopausal stage. So we have to make sure that, as I said, they don't have any other risks related with that would be related with the pregnancy. So that's why we have to evaluate if they use any medications and if they have any other chronic diseases. We have to evaluate them very well before we start these medications, and we start preparing them for these treatments. Apart from that, the most important thing is we know that after the age of 45, even with egg donation, unfortunately, the success rates keep on decreasing. And just to minimize these potential complications, we always recommend single embryo transfer, because even after the age of 40, with their own eggs or egg donation, the risks of like miscarriage, preterm delivery, or diabetes, hypertension during pregnancy, they are increased. And they are way more increased if they get like twins or triplets, etc. So single embryo transfer should always be recommended for patients over the age of 45 or even 50.
Is there any extra care or monitoring that these patients should seek after coming back to their country?
No, but during the pregnancy, yes, they shall seek some advice, because there are two things. The first thing is some of the prenatal testings that are testing the embryos, chromosomes, or their well-being, they have to give not their own age, but the donor's date of birth. So in that case, we would like them to get in touch with us so that we can provide the donor's exact date of birth. This is the first point. And the second point is, yes, their doctors should evaluate them, but every obstetrician would note such risks, and they would be having maybe more frequent follow-ups during their pregnancies.
Can you tell me why patients from Ireland choose Dunya Clinic? What do you usually observe? What appeals to them?
We have open communication with them, and we provide individually, we individualize their treatments, and according to the most evidence-based medicine, and they don't have any waiting lists, and we have high donor availability, and the costs are very, I guess, more achievable. Also, it's a nice country with sun throughout the year, and also the legislations and laws allow us to do these genetic testings on the embryos.
Could you tell me about maybe a specific case or a couple from Ireland which you supported for treatment?
From Ireland, we had a recent case, and she came to us after 6 IVF attempts, and she had low ovarian reserve. So we decided on embryo pooling and then do the genetic testing. We did 3 cycles with them, and then we managed to find 1 healthy embryo, and we did the embryo transfer at the end of the last year. And nowadays she's 15 weeks pregnant.
Can you, just for the viewers who might not be familiar, can you say a bit more what embryo pooling is and who is it useful for?
So embryo pooling is where you do the ovarian stimulation, do the egg retrieval, but instead of doing the embryo transfer, we cryopreserve the embryos with or without genetic testing. So on day 5, whether we do the genetic testing and then freeze the embryos, or we don't do the genetic testing, we directly freeze the embryos. The logic is trying to accumulate as many as possible. It's generally recommended if a patient is willing to do these genetic testings, but their ovarian reserve is low, so they would be able to get as many as possible while their ovaries are still producing some follicles.